I'm going to show you how to save your dog's life with CPR. My name's Eve and I'm a registered veterinary nurse. If you find a dog unconscious or you see your dog suddenly become unconscious and fall to the floor, these are the steps you're going to want to follow. Remember A, B and C. A stands for airway. Is the airway clear? Is the neck extended? Are they choking on anything? Now, make sure the neck's extended. You can open the mouth and have a look. See if there's anything in there causing an obstruction. If there is and you can safely remove it, then do so, but don't risk pushing the object further down. Presuming the airway is extended and everything's all clear, you want to move on to B. Now, B is for breathing. Are they breathing? Now, the way you want to check this is, if you can't tell obviously straight away by looking, you can move your head lower down to the patient. Can you feel any air coming out of their nose or mouth? You can place your hand on the chest and see if you can feel any movement, but like this you can also see from this angle whether it's rising and falling. You can also do it just by using your hand in front of their nose and mouth. Presuming that they are not breathing, you then want to move on to C, which is circulation. Now, circulation is there a heartbeat? You can do this by feeling directly over the heart. To figure out where the heart would be, you can pull their front leg back. Wherever their elbow falls, underneath that is directly where the heart is going to be. The other way that you can check if you can't feel here is using 2 fingers on the inside of their back leg. Now, this is where the femoral artery runs, so you should be able to feel it pulsing. You want to spend a maximum of 10 seconds checking this initially before moving on to your CPR. An easy way to make sure you can do this is when your dog is sleeping, having a little feel on top of their chest or on the inside of the back leg to see if you can feel their heartbeat. Once you do this regularly enough, you get comfortable with feeling when there is a heartbeat. Also, get used to watching them when they breathe and making sure that you know what you're looking for. Because when you are in this traumatic situation, your brain is going to second guess yourself and you're going to think, maybe I can feel a heartbeat, maybe I can't. If you think that you can't, move straight on to these next steps. Now, presuming the airway is clear, there is nothing blocking the throat, they are not breathing and there is no heartbeat, then you want to move on to your CPR. So to start this, you do rescue breaths. Now, you want to deliver 5 rescue breaths. You pull the tongue out to the side of the mouth and hold it with your hand. You want to seal their mouth closed. Now, you do this keeping them on the floor, but I'll lift the dog up so you can see. Seal their mouth closed with your hands. For bigger dogs, you want to seal your mouth around their nose, so around the nostrils. For smaller dogs, you can put your mouth completely around the snout. For the 5 rescue breaths, you want to, instead of delivering them like, you want to deliver them a little bit slower. So you want to go, I'll show you what that looks like. Also, between breaths, you want to pull your mouth away slightly to allow the air that you've breathed in to come out. There you go. When I do it, I can see the chest. I can watch the chest rise and fall. You don't want to deliver too much air and overinflate the lungs. Now we've delivered 5 rescue breaths, you want to move on to your compressions. Now for these, you want to interlock your fingers and lock your elbows. You want to use your body weight over the top of your arms to deliver enough pressure. So instead of like this, you want it to look like this. So you're moving your body weight on top of your arms. You want to place the palm of your hand over the top of the heart. Now, to know where the heart is, you pull the elbow back, you pull the arm back, and wherever the elbow lands on the chest is where the heart is. So interlock your fingers, place your palm over the top of the heart, and then you want to deliver 30 compressions. Now, the depth you want to do is 1/3 to 1/2 of the dog's chest depth. Obviously, this changes depending on the size of the dog. One thing you want to remember is always when you're giving a compression and you give it 1/2 to 1/3 depth down, you want to make sure that you are pulling up enough to allow the chest to fully open again. So you compress and pull up to allow the chest to open. I will show you what 30 compressions looks like. You want to do it to the beat of the song Staying Alive. People are now saying like Baby Shark. Is that how you even say it, Baby Shark? Anyway, it looks like this. There you go. That wasn't 30, but you get the idea. Then the cycle continues. So after your 30 compressions, you go back to your breaths. Now for this, you just deliver 2 breaths. So 2 breaths, 30 compressions, 2 breaths, 30 compressions, and just keep going. You ideally want to keep stopping and checking for signs of life, but you want to do this very, very quickly. If there's 2 people there when somebody is giving a breath, you can quickly check the femoral artery to see if there is a pulse. The other way to tell if there's any signs of life is normally a dog will show you. You will see some kind of movement, some kind of sign. The most important thing is continuing your CPR whilst contacting the vets. If there's somebody there, get them to ring the vets and phone ahead while you make your way down. Now, you can deliver CPR while you're in a car as long as you are doing it safely. You still want to make sure you are safe and wearing a seatbelt in the back of the car. I know that's a hard rule to follow. Today with the CPR, I'm going to answer some of the most commonly asked questions on my viral CPR video. A lot of people were asking me what to do for a really small dog or a really big dog. Now, with a really big dog, you want to do the same thing. You're going to have to put a lot more pressure behind you though, so you're going to get very tired. Ideally, if you've got 2 people, you want to be swapping and changing on who's doing the CPR and the compressions to make sure you're getting a little rest. Now, for smaller dogs, if you've got really small dogs, you can just use one hand. So you place your fingers underneath the chest and your thumb on the top, and you can deliver your compressions just by closing your hand. You did so well. You could also, for really, really tiny dogs, say newborn puppies, you can use 2 fingers. So you can just use 2 fingers on the chest to deliver the compressions. One critical difference is barrel-chested dogs. So if you've got a dog with a chest shaped like this, as opposed to say Mabel, whose chest is shaped like this. So let's say this is the bottom of her chest and this is the top of her back. When I'm doing my compressions, say if I was doing my compressions on this side, her chest is going to compress. It's going to be able to pump the heart and pump the blood around the body. If you've got a barrel-chested dog, if I'm doing my compressions on this side and the dog's chest is shaped like this, when I do my compressions, I'm not going to be able to get enough movement to be able to pump the heart. For these types of dogs, what you want to do is flip them onto their back. So say this is their back, like this, and you do the compressions underneath them, so here on the underside of their chest, which will then pump the heart, like this. So just like you would in a human, you'd have them on the back. You want to have the dog laid on a hard surface and ideally on their right hand side. Now, any CPR is better than none. If for any reason you cannot match one of the requirements, then do what you can. I had a lot of people asking me what to do if they can't feel a pulse but they're unsure, they don't really know. If the dog is completely unconscious and you have enough reason to believe that they are not alive, just start with your CPR. If for any reason you can't deliver breaths, just start with your compressions. I hope this video was useful. If you've got any questions, leave them in the comments for me. And if you want to be notified when I do any further videos, don't forget to hit subscribe. Keep your pets safe. Love you. Bye.